Contraception is used to protect you from an unplanned pregnancy and to avoid sexually transmitted infections. When it comes to your sexual health, it is important to choose the contraception that fits your situation and lifestyle. We have broken down the contraception methods into two categories: short-acting and long-acting. Short-acting methods of contraception are a good choice if you may want another baby soon. You must remember to take them or use them regularly or each time you have sex. These methods include the contraceptive patch, the contraceptive ring, the combined pill known as the pill or the progesterone-only pill, mini pill, external male condom, internal female condom, and diaphragm with spermicide, also known as the CAP. Long-acting contraceptive methods are more effective than short-acting. They are suitable if you wish to space out your pregnancies or your family is complete. These methods include contraceptive implant, copper coil, also known as the IUCD, hormonal coil, also known as the IUS, contraceptive injection, permanent male sterilization, a vasectomy, and female sterilization, tubal ligation. Things to consider when choosing your contraception: the options currently available or which methods your GP provides, your stage in life with family planning, how effective the different methods are and how easy they are to use, how different methods prevent STI transmission, side effects, contraindications, and most importantly, cost. For more information, visit www.sexualwellbeing.ie or speak to your GP. Emergency contraception is a backup contraception that can be used to avoid an unplanned pregnancy after you've had sex without using contraception, or if your method of contraception has failed, condom slipped, or you missed the pill. You can use emergency contraception up to 5 days after having unprotected sex. There are two options: the emergency contraceptive pill, the ECP, or copper coil, also known as the postcoital IUCD. You do not need a prescription for the emergency contraceptive pill. You can get it for free directly from your pharmacist. Under the free contraception scheme, you're entitled to free contraception if you are a woman or person with a uterus, you are aged 17 to 26, you live in Ireland, you have a PPS number. This scheme covers GP or doctor's appointments to talk about contraception and for repeat prescriptions when needed. Prescriptions given by your doctor, fittings and removals of implants and IUDs or IUSs known as coils, any checkups or other follow-up care needed relating to your coil or implant, emergency contraception, morning after pill. Please speak to a healthcare professional for more information.
Cervical screening in Ireland has changed.
For me.
For me.
And for me.
Next time you come for cervical screening, your sample will be tested for HPV, the human papillomavirus, a common virus that can cause cervical cancer. This type of screening is the best way to see if you're at risk of cervical cancer.
And some people will need screening less often.
Make sure you're on the register at hse.ie/cervical check.
So now I'm going to take you through the 8 signs and symptoms and what to look out for. If one breast is significantly bigger than the other, if one breast drops lower than the other, so your nipples are not aligned, what we're looking on the nipple area is any inverted nipple, any discoloration around the nipple area, any fluid or blood coming from the nipple. Our obvious ones are our lumps, okay? So that we've lumps on the breast. Your main ones are your lumps. Any dimpling of the nipple area, any puckering of the skin, and then on our rashes, you're looking out for, it's like a pinprick mark, okay? So you can imagine a red pen dotted around the under part of your arm here, and you're looking out for like an orange peel. It feels like an orange peel rash also. You can imagine when you get your sore throat, your glands are sticking out. And underneath the armpit, if there's any swelling of the gland at all, that is also a sign of breast cancer. To finish this presentation, please take a moment to watch this clip on how to perform a self-examination.
Breast carcinoma, or breast cancer, is the most commonly occurring cancer in middle-aged women. The breasts are specialized accessory glands of the skin, consisting of ducts embedded in fatty tissue. Breast cancer can arise in the duct system anywhere from the nipple to the terminal lobule. Periodic breast self-exams are essential for early identification and treatment. The breast self-exam should be done regularly, every month immediately following the menstrual cycle. Step 1. Visual inspection. Look for any changes in the skin over the breast, like redness, swelling or puckering, and nipple changes, like discharge, scaling, or indentation. Step 2. Tactile inspection. There are 3 ways to physically examine the breasts. The circle method. Move the 3 middle fingers in a circular fashion starting from the outer edge of the breast towards the nipple. The line method. Move the 3 middle fingers starting from the underarm area down below the breast. Move slowly back upwards, repeating this until the entire breast is felt. Wedge method. Move the 3 middle fingers beginning at the outer edge towards the nipple. Repeat the procedure for every wedge until the entire breast is felt. Regardless of the method, the objective is to feel the entire breast and observe any abnormal changes. The breast should be soft and smooth to the touch. Pay special attention to check the underarm and upper chest areas.